Work at Heartland OBGYN. I've been working there for about 10 years, and I see women of all ages, but one of the things that I do there in particular is care for teens who are diagnosed with sexually transmitted infections. In Daviess County, we do see a wide range of STDs. In our office, we see everything from gonorrhea and chlamydia, something that's treated with an antibiotic, to things like HIV and herpes, which can be lifelong infections. The most common sexually transmitted disease is human papillomavirus, which is also called HPV. It's an infection that once you have it, your body will always have it. HPV is the cause of 99% of cervical cancer. There is a vaccine now available that's called Gardasil. It protects against 4 strains of HPV. 2 of the strains that it protects against cause about 75% of cervical cancer, and the other 2 strains cause 90% of genital warts. Both girls and boys can receive the vaccine, and it's recommended for ages 9 through 26. If you are sexually active, you should have an exam by your provider at least once a year, or if you change partners, you should go back in to be treated again. It's always important to be honest with your medical provider so that they know if you're in a high-risk situation. If you have any specific concerns, you can be asked to be tested for certain diseases, such as if you know a partner was diagnosed with a certain sexually transmitted infection. You should never be embarrassed to talk to your medical provider about the possibility of an infection, because if it goes left untreated, it can cause permanent damage that could lead to cervical cancer or infertility, especially in females. It is not unusual for a girl to come in just for her annual exam, or perhaps to get birth control pills, and while she's at the office we test her for STDs and find out that she does in fact have a sexually transmitted infection. It happens quite often because most sexually transmitted infections do not show any symptoms. If they do show symptoms, it often takes weeks to months before an individual will have symptoms. Boys especially do not usually have any signs of infection, and so they unknowingly spread things like gonorrhea, chlamydia, herpes, or warts onto their partners without even realizing it. The most effective way to prevent a sexually transmitted infection is to abstain from intercourse. The other thing to remember, though, is that some infections, such as herpes or HPV, can be spread just from skin-to-skin contact. So even if there's any type of sexual activity, some infections could be spread. If a teenager chooses not to abstain, it would be wise to always use a condom. We recommend that you use a latex condom, and if you use any type of lubricant, it should be water-based, because things like KY jelly or body lotion can break down the latex and make the condom ineffective. The condom is going to be effective against things like HIV, gonorrhea, chlamydia, or trichomonas if it's used effectively. But even when you're using a condom, things like herpes or HPV can still be spread through that skin-to-skin contact. And even if the patient or the individual doesn't have a sore, they can still spread that, even if the skin looks healthy, because there can still be viral shedding even if there's not an active lesion. HPV can be spread to a baby during delivery, and it's very rare, but they can get an infection in their throat, and so the HPV will live in their throat. And so then if that guy is never sexually active, his wife is never sexually active, she could still get HPV, which could cause cervical cancer from her husband because he got it from his mom during delivery. The absence of symptoms does not necessarily mean that there's an absence of infection. So even if you are not having any symptoms of a sexually transmitted infection, it's still really important to see your provider at least once a year to be tested for STIs. Genital warts are also very common. They too are caused by the HPV. If you have 2 or more partners, you have a 50% chance of developing genital warts because it's just that common. Okay. In Daviess County, we do treat all sexually transmitted infections. We see patients with gonorrhea, chlamydia, hepatitis, HIV, syphilis. Gonorrhea and chlamydia are very common, and we treat those daily.